Hello, I'm Dr Jacqueline Small, President of the Royal Australasian College of Physicians. I would like to acknowledge the Gadigal people of the Eora Nation as the traditional owners and custodians of the lands I'm speaking on today. I extend my respect to all Aboriginal, Torres Strait Islander and Maori people. Together, we restate our shared commitment to advancing Aboriginal, Torres Strait Islander and Maori health and education as core business of the RACP. Today, I want to talk with you about the importance of the first 2,000 days of life and the degree to which they affect the following 30,000 days. Most of you know that I'm a paediatrician and so am deeply aware of the importance of the first 2,000 days for a child's health and well-being. Within our college, our disciplines of adult and paediatric medicine, public health and other faculties tend to practice in silos. Yet, there is direct relevance and impact of the experiences during early childhood on health across the lifespan. Research shows that adult morbidity is predicated on both pre- and postnatal experiences. We've long known the impact of a mother's physical health on a developing child and adult, how a lack of folate can have catastrophic effects on the spinal cord development, how the mild symptoms of maternal rubella lead to impaired vision, hearing, and intellectual development. But what about psychosocial factors? If a mother suffers more than 5 stressful life events during pregnancy, her child would likely manifest abnormal development later in their childhood. That's one of the findings of the 30-year-long RAIN study in Western Australia. In other words, the mental health, the psychosocial health of the mother during pregnancy and early childhood has an impact on the psychosocial health and development of the baby and ultimately the child and the adult. The developmental origins of health and disease, DOHAD, means that lifelong morbidity is established in the early years. Many of you will recall that the late British epidemiologist Dr David Barker established a link between low birth weight and adult coronary artery disease. We're now seeing evidence of the neuroanatomical manifestations of early childhood neglect. PET scans of children in Romanian orphanages who suffer extreme neglect show patterns of darkness where brain architecture hasn't developed, compared with a normal PET scan of a healthy, red, lit-up brain. We know from a UK study that a developmental assessment at just 22 months is an accurate predictor of that child's educational outcomes at 26 years. The data shows that even life expectancy is affected by childhood psychosocial factors. A pivotal study in the US by Dr Vincent Felitti related the health of more than 17,000 adults to those who had adverse childhood experiences. It assigned them what is known as an ACE score out of 10. Childhood experiences such as domestic violence, substance abuse, mental illness, parental separation or divorce, or incarceration attract a score of 5. A child with an ACE score of 6 or more is predicted to die up to 20 years earlier than one with a score of 0. Many adults don't think that domestic violence or the circumstances a baby grows up in will have an impact on that baby. They also don't understand the enormous cognitive and emotional development that happens before the onset of speech. We can be encouraged that protective factors can buffer the impact of stress and support healthy development. This includes things like parenting programs, substance abuse treatment, high-quality childcare, and income support for low-income families. However, the biggest gains are when intervention occurs during early childhood. Investing in early childhood produces a return on investment of $13 for every $1 you put in. The evidence is clear. Early intervention is a smart investment. We can be proud that our college has policies and has been advocating about the importance of the first 2,000 days. You can read our position statements on early childhood, inequities in child health, and the Kids COVID Catch-Up campaign. The RACP also recognises the impact of socio-economic determinants of health. Have a look at #MakeItTheNorm. A strength of our college is our diversity. That is, that we include members whose practice is with premature babies, the youngest of our patients, and members whose practice is with the elderly. Collectively, we can advocate to make a difference to the health of our communities across the lifespan by advocating for early intervention in the first 2,000 days. Early childhood is relevant for all of us. Imagine if we routinely took account of the early childhood history and experiences, no matter what the age of our patient. I want to acknowledge Associate Professor Elizabeth Murphy, a member of our college and Senior Child Health Advisor in New South Wales Health, for her support with this video. Thank you for watching.